Hello friends, I am Dr. Amandeep Kaur Anand, obstetrician gynecologist and infertility consultant from Jammu. Today I am here at ICAT Academy for hands-on training by Dr. Pankaj Talwar in his course Code 3. It is a 14-week certified program, and today I'll be talking about the Antagonist Protocol for Ovulation Stimulation. Antagonist Protocol has recently gained a lot of popularity, and most of the IVF centers are using Antac protocol only because of its low incidence of OHSS and decreased requirement of the hormones. In this protocol, we divide the patients on the basis of their AMH levels and their response. It is, if AMH level is between 1.5 to 3, it is a normal responder. If it is less than 1.5, it is a poor responder. If it is 3 to 6, it is a PCO or a hyper responder, and if it is more than 6, it is a dangerous PCO. In this protocol, we call every patient on day 2 of our cycles, and we do the TVS scan to see whether all the oocytes are of all the follicles are with synchronous growth with 2 to 4 mm size, and ET should be less than 4 mm, and then we start stimulation on day 2. The day 2 of the periods of the patient is now day 1 of the stimulation. We start stimulation of the normal responders with 225 units of FSH for first 5 days, followed by HMG 300 units for the next 5 days, that means day 6 to day 10. On day 5, we call the patient for TVS again, and we see whether the lead follicle is 14 mm size or the ET has to be 6 mm. It should be either or both of the two, and then we add on injection cetrorelix, which is antagonist, and 0.25 milligram daily till the day of trigger. Depending upon the patient's findings, we can call patient on the alternate day or every 2-3 days to start the injection cetrorelix, and mostly usually by the day 10 of stimulation, the patient is ready for the trigger day. We give trigger when the 70% of the crop is of the size of 20 mm, and when we give using Antac cycle, we can give trigger with agonist, which is mostly Lupride 2 milligram we can give, or we can give Deca also. Now, if the patient is less than 1.5 AMH levels, in that it is a poor responder, so we start with 300 units of HMG straight away, and we give 300 units of HMG for the 10 days. Here again we add cetrorelix when the lead follicle is 14 mm or ET is 6 mm. But here we also add growth hormone from the day of stimulation till the day of trigger. Now, if AMH levels is more than 3 up to 3.5 to 6, here we decrease the dose of FSH to 150 units. We give 150 units of FSH for 5 days, followed by 150 units of HMG. Rest of the protocol is same. Now, if the patient is 6 or more than 6, here we try to give chronic low dose protocol. Here we give 75 units of FSH followed by, for first 5 days, followed by 75 unit of HMG. We let the follicles to grow slowly till the day of trigger, which is again when the 70 ml, and then we give the trigger. Here also we add cetrorelix. It's a flexible protocol in which we give cetrorelix 0.25 milligram when the lead follicle is 14 mm or ET is 6 mm till the day of trigger. Thank you.